A protein in your blood can increase the risk of erectile dysfunction by 3.5 times, and most doctors aren't even testing for it. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm telling you about new research that links two specific blood tests that are not a routine part of your evaluation that are linked to erectile dysfunction. Now, erectile dysfunction, or the inability to sustain or maintain an erection sufficient for penetrative intercourse, is very, very common. It affects somewhere between 10 and 25% of men globally, meaning 1 in 4. And it's estimated that 322 million men are struggling with this problem worldwide. Now, problems with erections are not just because you're getting old, and they're not just signs that you don't have enough testosterone. In most men, it's a sign of a problem with your blood vessels in your heart. One that you see long before you ever have chest pain, or even sometimes before you develop any other problems. This is because the blood vessels that supply the penis are about half the size of the blood vessels that supply the heart. So when you have problems with your blood vessels, like a buildup of cholesterol, that actually affects your penis long before you have a heart attack. In fact, it shows up on average 2 to 5 years before you have any cardiovascular issues. And that's exactly why we need better tests to help us identify who's at risk of vascular damage and how that links with problems with erections, so we can actually track it and use it to make changes. Now, to figure this out, researchers wanted to find out if certain blood tests were linked with erectile dysfunction. But what they really wanted to understand was if these blood tests are associated with erectile dysfunction, is it just happenstance? Do they just happen to occur together? Or does a low blood test level actually cause erectile dysfunction? To answer that, they looked at genes, your genetic makeup, using a technique called Mendelian randomization. Now, your genes are fixed at birth. You don't get to choose them, and your lifestyle factors don't change them. Certain genes are known to influence blood levels, and specifically the blood levels that these researchers were testing, apoprotein A1 and apoprotein B. Researchers wanted to ask if people who are predisposed genetically to have lower levels of ApoA1 also tend to develop erectile dysfunction at higher rates. And if so, that's a much stronger signal that the protein is actually driving the risk. So in this study, they did 2 separate analyses. In one analysis, they examined 224 men who had previously been diagnosed with erectile dysfunction. But the interesting thing here is most studies, they just ask them a questionnaire. Here they took it a step further. They used nocturnal penile tombs and rigidity monitoring, or NPTR. What this does is it measures normal erections during sleep, if they're having them, and how often they're having them. Because when you're having normal erections at night, it tells us everything is working normally, meaning your blood flow, your hormones, your nervous system, they're all working normally. But when you're awake, your brain plays a role, and your stress, anxiety, other things can affect the ability of you to get an erection. And so when you do this test, it can help you distinguish between erectile dysfunction that's completely from biological issues, meaning in your body, versus psychological issues, meaning in your brain. Also pulled from large genetic databases, including the UK Biobank, which is one of the most comprehensive health research data sets in the world, to identify genetic variants linked to blood proteins, and then tested whether those same genetic variants were associated with erectile dysfunction in a Finnish population using the FinGen database. They basically looked at a total of 700 men with ED and 94,000 men without ED. And so what were these blood proteins? As I mentioned earlier, they're called apolipoproteins lipoproteins. These are proteins that help transport fats, including cholesterol, through the bloodstream. So basically, they're like carriers of these cholesterol molecules. More and more research is saying that these numbers are actually more valuable than just HDL and LDL alone, which are the blood tests that we look at when we test your lipids at your regular doctor's visit. And so what researchers found was that specific apolipoprotein lipoprotein levels are strongly linked to the risk of having erectile dysfunction. Let's go through them. First, apolipoprotein A1 or ApoA1. This is the carrier protein that carries HDL, your good cholesterol. Basically, this is what helps move your cholesterol away from your arteries and back to your liver so that it gets cleared from the blood. Study found that men with lower levels of ApoA1 had a 3.5 times higher likelihood of developing ED, 3.5 times. That's not a small number. And the number they found that was most indicative in the study was 0.95 grams per liter. Second is HDL cholesterol. Now, you probably have gotten this lab tested from your regular doctor. HDL is the good cholesterol. And in this particular study, when guys had higher HDL levels above normal, they had a 33% lower risk of developing ED. Third is apolipoprotein B, or ApoB. ApoB is the other side of the equation. It is the primary protein found with LDL, or the bad cholesterol, and high ApoB levels are associated with more cardiovascular risk and more arterial damage. So in this study, higher APO levels were associated with a greater risk of erectile dysfunction. But what really mattered, I think, more than just APO was the ratio of APO1 to APO. This is the ratio that compares your APO1 over your APO. A lower ratio, meaning they have less APOA1 relative to APOB, less than 1, 26, was associated with a significantly higher risk of erectile dysfunction. But when you flip it, or you have more APOA1 compared to ApoB, you reduce your risk of developing ED by 70%. So what do you do with all this? First of all, ask for these tests when you see your primary care doctor, especially if you're experiencing erectile dysfunction and you haven't had a full cardiovascular workup. Make sure you specifically ask, because these are not in your standard lipid panel. Ask about apolipoprotein A1 and apolipoprotein B. In my clinic, I also will typically get that full lipid panel to check their cholesterol. I will check a hemoglobin A1C to screen for diabetes, as well as testosterone and a sex hormone binding globulin at a minimum. If those levels come back abnormal, we will do more hormone testing to investigate further. But why is this really important? Because if I can identify the vascular risk earlier, then you could intervene earlier and prevent erectile dysfunction from ever happening. And erections are very, very important, but we also don't want you to have heart attacks or strokes. Now, if your blood work shows these factors like a low APOA1, a low HDL, or a high ApoB, you need to make some changes. And what does that mean? That means getting regular aerobic exercise, at least 150 minutes of moderate intensity cardiovascular exercise, which has been shown over time and time again to improve blood vessel function, HDL levels, and is one of the most evidence-based things you can do. Diet. Make sure your diet is high in fiber with healthy fats, vegetables, and lean protein. This is going to help raise your HDL and lower your LDL. Specifically, a Mediterranean-style diet has the strongest evidence, but mostly because it's been studied the most, but it also has the strongest evidence for cardiovascular and sexual health. Next, avoid smoking. Smoking is one of the most damaging things you can do to your blood vessels, and it will directly cause erectile dysfunction. So if you smoke, that's the first thing you got to stop. And of course, manage your overall health. Make sure you control your blood sugars, your blood pressure, maintain a healthy weight. All of these are so, so important and help directly affect these apolipoprotein levels as well as your blood vessel function. Now, there are some caveats. The study gave us obviously some very valuable information, but it's not a perfect study. The sample size was relatively small, only 224 men in the cohort study. All of the participants were from a specific geographic region, meaning that we don't know if this applies across all populations. And we also know that while vascular dysfunction is the number one cause of erectile dysfunction, there's so many other factors at play. There's hormonal issues, there's neurologic issues that all can affect erectile function. And this study really only looked at one little piece of the pie. So, what do I want you to take away? Having problems with erections is a signal from your body about what's happening in your blood vessels. The same blood vessels that supply all your organs, including your heart. So at a very minimum, get your blood work done. Get it checked and have a real conversation with your doctor. And take your cardiovascular health seriously, because it's not just about preventing heart attacks in this case. It's about also maintaining good, strong erections for life and living longer and healthier. If you want to learn more about how your sexual health is actually a biomarker for your overall health and the pillars you need to live by to have a solid foundation for your sexual health throughout your entire life, check out my new book, The Hard Truth, available for pre-order. And if you get it now, you'll get over $600 in free pre-order bonuses, including my Erectile Mastery course, completely free. And as always, remember to take care of yourself, because you're worth